Good morning and welcome to Radio Friends on Monday, April the 8th. Good to have you with us today. We've got an interesting topic today. I want to introduce you to Dr. Sue and Dr. Zarek from MU Healthcare. We are going to talk about a new way of helping couples conceive a child who have not been able to do so in the past. You want to tell us about that?
One of the main ways that we now help couples is with something called in vitro fertilization, or IVF. And at MU Healthcare, Dr. Sue and I are here to help build that program, which is actually a technology that's about 40 years old. So it's not brand new, but in terms of the life and science and art of medicine, it is fairly new.
A lot of people may not be aware of how this works. Explain.
So in vitro fertilization is when we harvest the woman's eggs and actually mix the egg and the sperm outside of the body. So that's what in vitro refers to.
Okay, you harvest the egg and the sperm, and then you have a term that you call that. Did you call that date night?
I did call it date night. So date night happens in the laboratory.
Yeah. And then what happens?
Well, that fertilized egg is now called an embryo, and we've got excellent embryologists who help us grow those embryos, and it's usually more than one.
So the embryos are growing in a test tube in the laboratory.
That's right. So it's a petri dish now, but originally they were called test tube babies, which was, 40 years ago, 1978. The first test tube baby was born in the UK, actually.
What happens then? How long do you continue growing the embryos?
Generally for about 6 days. Would you say so, Dr. Sue?
Yes. Then what happens, Dr. Sue?
At that point, we have pretty good information about how the embryos are growing. And the quote-unquote best-looking embryos are picked by the embryologists, and then we do an embryo transfer back into the woman. So we place the embryo back into the womb of the woman using a little catheter. We do this under ultrasound guidance, and then we give some hormones to support pregnancy, and we have pretty good success rates doing this.
So date night normally happens in the woman's fallopian tube. And so this technology started for women's tubes who were blocked. There was no meeting place. And so from there, we found that laboratory is a nice way to help those couples.
How many couples have you helped so far?
Hundreds.
Yes, and worldwide, there have been over 7 million children who have been born as a result of this technology.
And if it were not for this technology, these couples would not be able to have children.
That's right. So for us, it's an incredible tool for us to help families have children.
Yes. Personally, how do you feel about it?
I feel wonderful. I love babies, and I love helping couples with that. So before, our tools were pretty limited, and so the success rates at best with the previous tools were maybe about 10%. And now with in vitro fertilization, it's not 100%, but now our success rates are somewhere between 65 to 75%.
Thank you both very much for coming by. We could have spent the whole segment on this.
Yes.
Thank you.